So this event is put on by Black Wall Street. This area has very rich history of Black folks thriving in the midst of so much. And we know that distrust is very real in Black and brown communities because of historical and very real contemporary inequities, you name it, research, medicine that people continue to see pop up. We see even with the COVID-19 pandemic that new cases, death, and hospitalizations look very different for Black and brown people. The data shows us that. So tell us if young people are talking about the distrust that exists, or isn't it an issue for Black and brown people? Like, are they talking about the Tuskegee, or here in North Carolina, we know that there were women who had forced sterilizations, or their uterus were removed. So are young people talking about that? And is it, in what context, how are they talking about this? Because it's an elephant in the room in many ways.
I've definitely heard that mentioned, especially when you say like the Tuskegee. I've heard that, but a lot of times I don't know like if that's really what they're thinking, or like they saw somebody on Twitter post that and they took it and ran with it. So like, of course, like I'm definitely not discounting that happened, but I know me personally, like when I heard about the vaccine, like, I was just like, oh, it's another vaccine we have to get. Like we have to be vaccinated for certain things to go to school anyway. So I wasn't really trying to look for different sources to say, oh, I shouldn't get this. But a lot of people like, they just didn't know anything to say about it, so they ran to the internet, and like that was the first thing that were popping up like about the different things in our community. So I do think like that can be scary, especially seeing like how it's happened in history, and history repeats itself. So it could they possibly could think it could be happening again, but I haven't really heard too much about it recently, especially like since they started having more vaccine clinics on school campuses and making sure they bring in more like physicians and the experts to like educate people about it. I feel like after everybody's like learned more about it, like what's going into it, how it's made, they're being more trustworthy of the vaccine and of the science behind it instead of just focusing on conspiracies.
Yeah, basically echoing everything that was already said. One thing about this Tuskegee experiment that I think is different from COVID, and somebody explained it to me like this: in the Tuskegee experiment, once like penicillin had become like the preferred method of treatment, they still withheld that treatment. But when it comes to the vaccine, they're not withholding treatment. They're trying to get people to take the vaccine, and so yeah, it's a little different in kind of methodology. So.